Hello, this is Dr. David Greene, CEO of the TEX-PAIN Network. Today's topic is my hip pain coming from a hip or a lumbar spine problem? Hip pain is very common. Millions of Americans suffer from hip arthritis. The pain can lead to disability and limited ability to walk, exercise. Close to 300,000 total hip replacements are done every year in America. And when pain is occurring in your hip area, it just seems obvious to assume the problem is actually coming from the joint. But it may not be coming from the joint. There may be an overlap in symptoms between hip arthritis and lumbar spinal stenosis. As individuals age, spinal stenosis is just as common as hip arthritis. Both occur from degeneration, and it can mimic hip arthritis. Here's a cartoon of lumbar spinal stenosis. It occurs with degeneration of the intervertebral disc, and that shifts pressure to the back, more stresses to the facet joints in the back of the spine, creating arthritis with bony and soft tissue overgrowth, and that can pinch on nerve roots as they're trying to get out from the spine. The pain that's experienced may go into the hip, and that can mimic arthritis pain. How do you differentiate between the two? Well, first, here's an MRI with spinal stenosis. It's actually, you also have some hard disc bulging backwards. Okay, so here's some spinal stenosis, arthritis. See how it gets really to minimal room there? And the nerve roots try and get out and they get pinched. Okay, you can see that here with some bone spurs. And on the other coin, here is an arthritic hip. Normal hip, you have normal joint space, a nice spherical looking femoral head. Okay, over here you start to have really no observable joint space. There's some cysts, there's extra bone formation. That's severe arthritis. So a history is very helpful. The area of the pain, the duration, when does it come, when does it go. Both hip and the spine can cause referred pain down one's leg. Physical examination, if you have point tenderness over your hip joint and range of motion pain, that's more in line with the hip arthritis going on. The neurologic exam is not very helpful. The shopping cart here is right out of a textbook. If someone has spinal stenosis, they typically feel better leaning forward because it opens up room for the nerve roots. So the story typically is, oh, I feel better when I'm in the shopping grocery store and I lean forward on the cart. That is right out of a textbook. Imaging studies can be very helpful. Plain films of the spine can show arthritis, but they don't show stenosis. So an MRI is a study of choice. You can see here, this is normally supposed to be almost an ellipse, but it's a little bit of a triangle, and that's significant spinal stenosis. You have on this CAT scan overgrowth of the joints here with some bony overgrowth, and you see it comes down to a little bit of a triangle. This is the same arthritic hip as we saw before. So just because you have this on an x-ray doesn't mean a person's going to have ridiculous hip pain. So what it often comes down to is diagnostic injection. So for instance, if you inject right into the hip and it provides 100% pain relief, you know it's coming from the hip. Okay? Epidural injections may not work the first time. You may need a series of injections, but what the pain doctor will do is put some numbing medicine right around the area of the nerve root pinching, and that can give significant relief. So here are the potential outcomes. You get complete hip relief with a hip injection, you know it's a hip problem. Okay? If you get complete hip relief with an epidural steroid injection, you know that it's a lumbar problem that's causing referred pain in the hip. If you get some relief from the hip injection and you get the rest of the relief from an epidural injection, you know the person is dealing with degenerative arthritis, and it's a combination of the two in the spine and the hip. There's always the possibility that neither injection will work well. In that case, the doctor will keep investigating to figure out what exactly is going on. The top pain management in Dallas is through the TEX-PAIN Network. There are several clinics throughout the Metroplex area, accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at painmanagementdallas.com, and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Greene with the TEX-PAIN Network. Your pain stops here.